I'd now like to invite our three speakers to join the table so we can have the moderator discussion portion. And I'd like to introduce... I'd like to introduce our panel discussant, Professor Kathryn Tabb. Professor Tabb is an assistant professor of philosophy at the Department of Philosophy here at Columbia University. Professor Tabb's work focuses on philosophy of science and medicine and on history of philosophy, especially early modern philosophy. Her historical research treats philosophical debates over psychopathology and irrationality, especially among 17th and 18th century British empiricists. In philosophy of medicine, her work focuses on contemporary epistemological and metaphysical issues surrounding the classification and diagnosis of disease. Professor Tabb is on the steering committees for Columbia Center for Research on Ethical, Legal, and Social Implications of Psychiatric, Neurologic, and Behavioral Genetics, and the Precision Medicine Ethics, Politics, and Culture Workgroup. Along with Professor Paul Applebaum, she is principal investigator for the grant project assessing intuitions about the genetics of virtuous behavior, which is a part of the Genetics and Human Agency Research Initiatives launched by University of Virginia. Thank you very much, Professor Tabb. Thanks, our speakers again.
Thank you, Federica. So my aim, I'm going to try to stay under 10 minutes, is to lay out the space of what I see as some of the main ethical and epistemic challenges concerning this topic. I don't work on psychopathy, so I'm going to try to kind of address the broader landscape of issues that I see as relevant to issues around moral responsibility, psychiatry, and the law. I doubt I'm raising any issues that will be new to our panelists, but I'm hoping to maybe prompt some thoughts among you all for a discussion. And I work in two areas, as Federica said, so I'm going to raise some issues just from philosophy of psychiatry, and then I'm going to raise two ethical concerns. So the first empirical question I have has to do with what we can really learn from neuroscience and how, using Professor Morse's language, how its results can be translated into the behavioral language of the law. I think that's a very crucial question. And I think it's important to assess the empirical value of neuroscience with respect to diagnostic categories like psychopathy. And it's not because I think there's anything wrong if the current results of neuroscience are questionable. The results of science should be questionable. That's what science does. But a philosopher of science named Mariam Solomon has made the argument that when we apply empirical work to practical contexts like the law or like medicine, the stakes become a lot higher for our uncertainty, right? Because the empirical results need to be translated in a way that will affect people immediately. So we need to be more conservative, and our tolerance for disagreement needs to be lower. So the worries that I think one might bring to bear and that are often brought to bear about the neuroscience of psychopathy and also of other mental disorders in part have to do with what Professor Morse and other work has called the brain overclaim syndrome. This is the tendency we all have to get really excited about newfangled scientific results. Some questions we could ask in the case of neuroscience is, are we measuring what we think we're measuring when we're bringing neuroscientific results to bear in the courtroom? So that's a question about kind of the validity of our constructs. We can ask how reliably we're measuring it. And then I think there's this really hard question, which is something that Professor Sifferd has talked about in her work, which has to do with how scientific results relate to our folk understandings of what's relevant in the law. We need to be able to translate scientific results into the language of folk psychology. And when these two conflict, when our folk psychology tells us one thing about responsibility and the science suggests another thing, I think there's an open question of which is right. And there's a question of who gets to decide whether we follow the science under any given circumstance or follow our more common sense judgments. And, you know, history doesn't show kind of a great record for science in the legal setting. I'm sure you all know the history of things like phrenology, which was a science that was used in the legal setting. And I just want to quote a verdict from the first time it was used in the United States in 1834, where the judge wrote, "Where people do not speak from knowledge, we cannot suffer a mere theory to go as evidence to a jury." Right? So already at that time, there was a worry that this was a theory. It wasn't the kind of knowledge that we wanted to bring to bear. And I wanted to bring your attention to a more recent case where we've had a change in our opinion about how scientific theory should work in the courtroom. And this is around the use of IQ assessments in death penalty cases. And in Hall versus Florida, the Supreme Court ruled that the simple number of the IQ quotient was not sufficient to make calls about who had an intellectual disability and who didn't. So Justice Anthony Kennedy says, intellectual disability is a condition, not a number. And we need to think about something like IQ more broadly than just using the scale that we have. In the case of psychopathy, right now there's a case that's under appeal in Canada, Ewart versus Canada, a 2015 case, about an assessment instrument used for psychopathy. And the worry is that this instrument is functioning as a tool of discrimination, or could potentially, because it's been argued that it leads to false positive diagnoses among Indigenous populations in Canada. Right? So there's a worry here that this tool allows for possibly racist agendas to be consciously provoked, or just for racism to kind of sneak in to our criminal justice system. So I just want to raise a concern that data-driven changes that claim to sort of maximize objectivity may not be sufficiently data-driven, or even if they are, may not be sufficiently objective. Okay, a second issue which Professor Morse anticipated I would raise has to do with the use of diagnostic categories like psychopathy in courts of law. There's a growing consensus among psychiatrists that we shouldn't be thinking about psychiatry as treating diagnoses or diagnostic categories. We might want to think about mental illness as dimensional rather than categorical. So what does this mean for the current conversation? It means that there might not be a fact of the matter about whether or not someone has something like depression or PTSD, which might mean that it becomes dangerous to think about these categories as guiding facts of the matter, like whether or not someone is responsible for an action or guilty or not. So I think in general, at this point, psychiatry suggests we need to be careful about thinking about broken brains as some kind of category we can rely on, instead of thinking about particular loci of dysfunction. If we do start thinking more about loci of dysfunction, it suggests that when we think about something like psychopathy, there may be a particular symptom or an underlying mechanism causing a symptom that is really what our intuitions are responding to when we say that the psychopath is not responsible. And a few of these were raised in the discussion. So we might think that responsibility is compromised by something like a lack of impulse control or a lack of moral knowledge, diminished executive control. Now, each of these, I think, are not specific to people we diagnose as psychopaths. These are mechanisms that might function similarly in people who don't share this diagnosis. So then we face a dilemma. Do we want to mitigate responsibility in the case of everyone who shows a dysfunction in that sort of mechanism? There's another big philosophical problem here that I don't really have time to go into, which just has to do with the question of what dysfunction is, which is something that over in philosophy of medicine is a big old headache, right? But I will table that. Okay, I want to quickly raise two ethical concerns. One is more pragmatic, and that's that it's not clear from the data how people tend to respond to information about deterministic causes for criminality. So my colleague Paul Applebaum has done a lot of work on what he calls, and other people call, the double-edged sword effect, which is, on the one hand, if you tell someone that a criminal's behavior was determined by a gene or a suite of genes, let's say, they might think that's exculpatory, because they might think it's not the person's fault any longer because their behavior was determined. They also might think that it's an aggravating factor because they might think that it makes the person more inclined to commit future crimes. And that's something that came up a lot, I think, in this discussion. So because we don't know how people respond to this sort of information, and I think, by the way, that's very much of our time, right? I think our intuitions might kind of straighten out, but right now people are responding in all kinds of ways to this sort of data. I think that complicates its use in the courtroom. The final point I want to make is more kind of broadly ethical. And this has to do with a worry I have about the authority of science. And I think that can be neuroscientific data, but I think that can also be the kind of language, diagnostic language that you've heard in this session, using the terminology of psychopathy. I'm concerned about this language, that this language is being used to settle what I think is ultimately an ethical question about what we mean by justice. By bringing to bear scientific evidence regarding moral responsibility, these methods lend a kind of objectivity to the notion of moral responsibility that I think is currently undergirding our legal system and allowing it to function. So there's an assumption here that we punish people because they're morally culpable and because they deserve it. And we want to do better at figuring out who's culpable and who should be punished, and these methods, the idea is, can help us do better. I think that even if you think that that kind of retributive justice model is the best way to go, and is the aim of our criminal justice system, you might still think that right now we're doing a really bad job at it. You might think, for example, that no human being deserves the kind of treatment that's currently being meted out by our prisons, including deprivation from family and sometimes all human contact for years on end, a lack of mental and physical health care, or a lack of proper legal representation. So what I want to leave you with is just the thought that this technology needs to be assessed in the context of an unfolding civil rights crisis in America, where we have the highest prison population in the world, the highest rate of incarceration in the world. I think we need to attend to the fact that the majority of people who will be affected by the adoption of new technologies or the application of new diagnoses are people of color. Changes resulting from new technologies will join sentencing procedures we already have that already see a higher percentage of young people of color sent to adult prison than white young people, and prosecutors charging more minority defendants with offenses that attract mandatory sentences. And these are laws that already rely on science in all kinds of ways we find questionable, right? So our colleague here, Carl Hart, has done a lot of research on the fact that the law cares whether you were selling crack or cocaine, which he thinks is indefensible from a scientific perspective. So one might want to argue that neuroscience can help us address some of these injustices. And I think it's possible that it can, and that's an open question. But it's not clear to me that it will do anything to improve our fundamental framework for thinking about desert. That, to me, is the heart of many of these injustices. And this doesn't mean that neuroscience is useless for the law, but it means that its relevance to improving moral responsibility assessment, I think, fades away if we kind of move away from a retributive approach to justice and think more in terms of restoration. And this is because in the restoration case, we want a full description of what happened, right? We want to be able to fix it rather than an evaluation of guilt so that we can punish it. And there, we become interested in responsibility of types other than simply moral responsibility. And there, I think neuroscience potentially becomes more promising. And I think also, after sentencing, when we think about treatment, it's possible it can become more promising there. I don't think it's there yet, but we can hope for that. So I think we need to attend to how this conversation is happening today and in discussions like this that link together questions of moral responsibility and criminality, because I think ultimately we're talking about using science to justify retribution. And when we assess whether neuroscience has a place in the forensic setting, we're assuming that our current policies for distributing justice should be made more effective, rather than considering if we should maybe reevaluate them or change them. And ultimately, I worry that the veneer of scientific objectivity is being brought in to pressure us to think in a particular way about the system of justice that we have. It could be, of course, that you think we're doing all right in our court system, in which case I think this all gets a lot less troubling, but I wanted to put that on the table. Thank you.
Do you have any response to the...
I had a question. It was very interesting, and thank you for that summary. When you talked about the Canadian data and the Indigenous population would be biased, what exactly was the basis to that? Do you have any sense of it? Any data? So, was it just an opinion?
Well, it was based on expert witnesses, and the judge ruled with
right,
those
so,
witnesses.
somebody else may know, but Well, I don't think we have any data on that issue in Canada on the Indigenous population. So that's why I found it curious. I'm wondering, what's the data? Show me the evidence. And I'm not sure that in research there is any. Have you heard of any on bias? I think what we have studied is the African-American population. And it's pretty clear that if you take African-American prisoners, Caucasian prisoners, they just don't differ on psychopathy. There's a lot of research on that. A lot of research also on the validity of the psychopathy checklist in African Americans and Caucasians, valid. That's what the science and data show.
Yeah, I mean, I'm not an expert.
No,
All I'll say is the
no.
case is going through the court system right now. So obviously, some people think that there's sufficient evidence.
Yeah, because I question what they think. I mean, here I would stand up for the science in this respect, in terms of, don't use an assessment of psychopathy because it's racially biased. I don't think there's evidence for that.
Okay,
As a scientist,
I'll send you the case, and maybe we could talk about the details. Yeah.
I have one comment. I really enjoyed what you had to say and agree with most of it. When thinking about whether science is being used to push the retributive agenda, I think the answer is just the opposite. I think the retributive agenda is what is trying to set a brake on these sorts of things. If you look at virtually all the most harsh criminal justice reforms of the last 25 or 30 years, think of 3 strikes and you're out. Think of mandatory minima. Think of the crack versus powder cocaine differential. They were all justified, 100% justified on consequential grounds, not retributive grounds that is of deterrence and incapacitation. It's imperfect retribution, in my view, to be sure, and we'd like to do justice better, exactly as the speaker said, but I think thinking that we're using the science for retribution, and that is why the criminal justice system is harsh, I think is just not correct, at least in the last 20 or 30 years. It's retribution that has put a brake.
So I just want to specify that what I'm concerned about is the use of science for settling questions about moral responsibility.
Good. I agree with that entirely.
Yeah.
I think I agree with that too.
Yeah.
I think what you're getting at, Stephen, in a way is, no, I won't go into that now.
Kathryn,
That you're open to the audience.
I was going to say, I think I agree with Stephen regarding the science and retribution. I think, though, you identified the problem, which is that we have to translate the science into the categories that matter for retribution, and that's a really difficult problem. And the problem of psychopathy is that's an area where we just disagree about the way in which the science translates into the categories of blame. And that's why it's such a mess and it's so fun to talk about, right, as a philosopher and as a legal scholar. I also wanted to ask Adrian, the use of the checklist as a probation tool, I mean, do you agree that that has gone awry to some extent, right? Because there's lots of, in Illinois, we have these cases where it seems that people who are not really very qualified are administering the checklist in order to determine if someone should be eligible for parole, and that seems to have been used in those cases in a kind of discriminatory or even ad hoc sort of way.
I don't have my finger on the pulse on that issue. I mean, for sure, people need to be trained on the use of the psychopathy checklist. I can imagine people could make wrongful assessments on psychopathy if they're not trained, absolutely, for sure. I just don't know what exactly is happening, so I shouldn't probably comment further on it.
On the MacArthur Risk Study, which was the largest gold standard study looking at the relation between mental illness and violent future conduct, full disclosure, I was part of it. What we discovered was psychopathy, measured reliably and validly by people who knew what they were doing, was an enormous risk factor for recidivism. It was a biggie. You pulled out of the decision tree psychopathy and you lost a lot of predictive power on recidivism.
All right, so I think we'll open up the floor, and if you raise your hand, I will put you on the list. Any questions for any of our speakers? Yeah.
Hi, first, it's an incredibly interesting discussion, and thank you to the panelists and everybody for coming and speaking. So I actually have a question in regard to disease jurisprudence that you brought up before. To my understanding, and correct me if I'm wrong, adult psychopathy or psychopathy is not a curable condition.
Correct.
It's interesting and much appreciated that research is being done into the altering of childhood indicators of psychopathy, and I think that's incredibly important. But when it comes to first offenders or secondary offenders as young adults, how should, and if disease jurisprudence is not an ethically reasonable thing to do, to send people into incarceration indefinitely, what is the answer to prevent violence?
Well, it's to me.
Or
I
to
thought
Or
this
to
was just-
all of you. I think this is something that was relevant.
Well, I mean, if you're talking about prevention, I mean, for sure, I mean, there's a long history of saying, hey, there's nothing we can do about psychopathy. And the argument that's been made is against that is, well, sure, so you take standard treatments like cognitive behavior therapy, which was, designed to help depression. And what are you doing? You're applying it to a totally different condition, psychopathy. So, okay, it doesn't work. So I think one of the problems is, and this is where I think science, can help, that what we need to do is work out what are the causes, the root causes of psychopathy, and we need to design new intervention and treatment programs to tackle the cause of psychopathy. And really, I mean, Ariel Baskin-Summers over there is actually should have given the talk I've given. She's a leading expert on the etiology and treatment of psychopathy, and she has done some very innovative work 2 or 3 years ago. Can you just talk a little bit about that, about and what we should be doing, Ariel?
Adrian's right. We should be understanding the causes. Sorry, thank you. Is it? Okay, great. So what we did basically was design.
Oh, by the way, Yale psychology over there.
Yeah, not random person off the street. We've designed basically computer games that target the specific neural mechanisms that are dysfunctional in psychopathic individuals to help them build compensatory strategies for navigating their world so that they notice contextual cues or moral violations much more clearly. And we've been able to show that by training these individuals on these computer games, we can reduce not only amygdala-like dysfunctions, but also their conduct problems within the prison system, so disciplinary reports. And all of this was based on the idea of exactly what Adrian said, which is treatment should not take a one-size-fits-all approach. We have to consider the cause of every disorder, not just psychopathy, and try and approach a more personalized treatment plan for individuals, but particularly when the disorders of psychopathy or antisocial personality disorder are not consistent with the kind of neural architecture of other disorders like depression or anxiety for which CBT was built.
I think just the counterpoint to this, which is always in my mind, I don't know what Ariel thinks, but if we can try and do something about the poor self-control that psychopaths have, if we can do something about their disinhibited behavior, if they have executive function deficits, can we do something about that? My worry is that we just make psychopaths better psychopaths.
Yeah. Hasn't there been some research on juvenile psychopathy?
Yes, Michael Caldwell.
There we go.
Yeah, Michael Caldwell in Wisconsin has this fantastic inpatient intensive treatment program for callous and unemotional, highly criminal youths that's expensive as heck to do, but in terms of a cost-benefit analysis, it turns out to be in the interest of the state of Wisconsin to do it because these kids recidivate a lot less as adults.
Yeah, there's a good popular article. Do you remember, Stephen, where that, I think it's maybe in the Atlantic? Covering that center, that gives a really good idea of what they're up to. Yeah.
And just quickly, just to pop in another thing, there's been only 2 randomized controlled trials of omega-3 in young offenders in prison. Both of them show over 4 or 5 months it reduces serious offending within the prison by about 30-35%, both a British study and a Dutch study, but there's no other study so far.
The question you raise is the basic one that I tried to raise at the very beginning of my talk about the gap. What do we do with people who are seemingly responsible but are dangerous? And as I pointed out, there are 2 ways we can try to exert social control over them. We can either expand disease jurisprudence, and that has problems, or we can expand desert jurisprudence, which makes the criminal justice system even harsher. At present, we're waiting to see what's going to happen when the doctor comes. But in the meanwhile, we've got to run a railroad. Everything here depends on your sense of justice and your sense of proportion. And my sense is I'm willing to take risks in the name of liberty. I don't like to live with danger either, but I'm willing to take risks in the name of liberty rather than pushing people around based on imperfect models and the like. So I don't like expansion of disease jurisprudence. I don't like expansion of desert jurisprudence. I'm willing to take the lumps. Call me soft-headed.
Okay, I think we had a question over here. Yeah.
can speak louder. Hi. So actually, I have two questions. I will be really quick in that. So the first one is, when you assess a psychopathy, most of the time you use a verbal test or a kind of verbal material in general. And this applies also to many experiments you have shown as well for assessing emotional traits and moral traits. So, but basically, there might be a big problem here, because when you show verbal material, you ask the subject to assess to his consciousness, while most of the brain activity works outside our consciousness. So it might be that you are not revealing any effect, because you are just tapping one part of emotional traits or moral traits, because you are passing through consciousness. Maybe what is not really working is our brain processes the work under our consciousness. That's the first question. And the second one is, you just mentioned before sort of an answer, that's two of them, no problem. But you just mentioned, or just let us imagine that there was a connection between amygdala functions and free will. But actually, as far as we know, the voluntary control and thus free will entails other regions, and probably it does not depend on a single region, but actually on the brain network. For instance, it has been shown that posterior parietal cortex, when stimulated in patients that has tumor and had to do surgery to remove them, actually stimulation of parietal cortex or supplementary motor cortex evoke what we call intentionality of movement. So probably free will does not born in a certain part of the brain, but in a network. So that's why maybe looking at a single region, you might not find a simple correlation between decrease or increase of free will and behavior.
Yeah, but by the way, I think I need to clarify something. And I think I was not clear, and I'm sorry about that. But in no way did I try and align amygdala structure function with free will. Yeah, free will is to me this amorphous concept. Where is it in the brain? Who knows? I don't have any insight at all on that. And so I think, I want to wash my hands off that sin.
Can I pick up on that?
Absolutely, do see.
Yeah, I think you've run together two different issues. One is the metaphysical issue. Do we have contra-causal, godlike powers of freedom? Are we uncaused agents where the buck stops with us?
No.
No, that's right. No, we don't. The kind of freedom we're talking about are exactly what Professor Sifferd was talking about when she talked about having certain kinds of capacities, certain kinds of moral capacities, rational capacities, control capacities. Those are what we're talking about when we're talking about moral or legal responsibility. Some people have more of them and some people have less of them. How much you need, and this has nothing to do with the metaphysical free will debate. This has to do with our ordinary, everyday understanding of human behavior. And on that dimension, we can argue about how much of these capacities and which ones you have to do justice by holding you responsible or not. But that's the level we're arguing about. We're not arguing about the metaphysical debate. Now, there was a question about consciousness and...
Can I...
please.
But in the philosopher has to say something about free will. Most philosophers would be very hesitant to try and assign free will to some particular structure in the brain.
By the way, just to say, I don't think anyone is doing that.
Really. I just wanted to say that lots of interesting accounts of free will now don't only kind of try and identify particular capacities that then we might assign to certain brain functions or not, but they're interested in these capacities over time. So the way in which you can have kind of self-control in this diachronic sense, so that you can manipulate your own environment such that you're likely to have make certain sorts of decisions more likely or less likely. So it's this, not only are we not worried about brain structures in particular, but that free will gets spread out across the environment and over time in a lot of the really kind of plausible accounts now.
I just want to pick up on your earlier point about that moral sense, and I think we're getting at the assessment in some way of, does this psychopath have a moral sense? And I think what I find is that actually, although we believe that psychopaths don't have a moral sense, I'm not entirely sure where it comes from. I think it comes from our sense of interviewing psychopaths. They don't conform their behavior to our sense of morality. But, Stephen, maybe they know exactly that what moral right and wrong is. Maybe they know it exactly. They just don't want to do it. And they just don't want to admit to that. So how do we know? And what I'd like to see, maybe from the science, develop a little bit further on this issue, because I think we do want to know, does somebody have a moral sense or not? That's important, isn't it? Can we use biological assessments in some way to get an objective sense of somebody's moral sense? In other words, show a picture of a moral transgression. I think most normal people with a moral sense will show a skin conductance and heart rate response to the moral transgression. Psychopath is going to be, if they are morally incapable, they're going to be less likely to show that objective indicator. And I wonder if that's some way that neuroscience could try and help Stephen's question about the severe psychopath lacking this moral sense and therefore not responsible in that way. Is that attraction there where neuroscience can help and inform a legal question? Because I think Stephen's convinced me a lot of neuroscience, it's not going to change, it doesn't fit right now with the current way that the law acts. The legal definitions, I think it's hard to get traction from neuroscience into those questions, very hard.
Well,
but that may be one where it can.
Well, look, if we look at the kinds of sciences we've brought to bear previously on these issues, think of psychiatry and psychology. Sometimes they treat you like a hunk of meat. Take this antidepressant. But if that's all your psychiatrist is doing for you, fire him or her. They also ought to be asking you about your life as an acting human being. So psychiatry and psychology sometimes treat you as an acting human being. They're very folk psychological, mental states matter. And sometimes they treat you as a hunk of meat. To the extent that the law treats you as a mental creature, a folk psychological creature, and Professor Sifferd has written about this more convincingly than anyone I know, then the translation from psychology and psychiatry are not going to be that hard because they're already treating you partially folk psychologically, a creature who acts for reasons just the way the law does. Think of neuroscience by comparison. It's a purely mechanistic science, purely mechanistic. The translation from pure mechanism to human action is going to be much more difficult. Neurons don't have reasons. Neurons don't have a sense of past, present, and future. Neurons don't have aspirations. Neurons, or even the connectome, doesn't have a sense of right and wrong. These are properties of persons. And here's my I wish I'd made this up myself, but a journalist made it up. When there's a disjunct between the brain data and the behavioral data, actions speak louder than images because the law is concerned with human action, acts and mental states.
With regard to skin conductance sort of information, I would just say that what we really need to know is the way in which whatever is going on in that case, how that feeds into behavior, right? So I don't know if we care how they react when they're looking at a particular sort of image if we don't understand how that, whatever is happening in that moment, translates into their behavior and their behavioral control and how they understand kind of rules, for example.
So what we know from the behavior is that the behavior is not conforming to a moral sense, right? So, I mean, does it end there?
I'm not
Do you need any more?
So we know that they fail to behave in certain sorts of ways, and then we know that they don't have a certain sort of skin conductance reaction to a certain sort of picture. But connecting, I think there's still some dots to connect between those two.
Yeah, but you see, to me, you're getting something objective as opposed to sitting down with an individual trying to weigh, do they have a moral sense or not? I'm a bit suspicious of the clinical approach to assessing, does this person have a conscience? Does this person feel remorse and guilt?
Well, it seems to me the point is that then there's a huge amount of translational work that needs to be done to convert the signs that you're reading into the
legal categories that seem to matter to couples.
The question is, let's say, heart rate differential or skin conductance differential, is this really a good marker for a moral sense? But how do we know something is a good marker for a moral sense unless we've already identified the moral sense in advance? And that's, by the way, a major problem with neuroscience altogether. We now know something about the neuroscience of impulsivity. Why do we know that? Because we already identified behaviorally who's impulsive. We now know something about the brains of people with schizophrenia. How do we know that? Because we've already identified these people as suffering from schizophrenia using behavioral techniques. In other words, by and large, the neuroscience is parasitic on the behavioral science, virtually always, for purposes of the law.
Okay.
Pardon?
Okay. I have a cue though, but okay. Go.
I'd like to talk a little bit about a word that hasn't come up today, which is sadism. You've talked about many overlapping mitigating factors, whether morally or legally. We've looked at temperament. We've looked at brain differences from birth, not so much those that have been caused by damage, such as severe head trauma, which may also be coexisting. We've talked about all kinds of moral and ethical biological markers, but that word has not come up. You talked about preventive detention for someone like Anders Breivik, who had a political motivation. We've seen a lot of mass murders recently who had coexisting mental illness, perhaps overlapping personality disorder. However, what do we do with the most dangerous, the most sadistic, who simply enjoy hurting people? They have fun. Brought up Minority Report. I'd like to bring up Clockwork Orange, which I think is really the gold standard. And
Kubrick was a great director, wasn't he?
New York actually has a term they have called a depravity scale, and it's used to distinguish murder of a certain sort from less serious crimes. There is a group of forensic psychiatrists and psychologists here in New York City who are trying to come up with a scale for depravity. But what the New York Court of Appeals, which is your state's highest court in New York, basically they're looking at, was the crime committed particularly atrociously, particularly heinously, particularly cruelly? This is the closest I think the law comes to addressing your sadism issue. But to give you an example of what your highest court has said in a recent case, young man rapes a woman, and then he basically beats her head very badly. And then to stop the blood from flowing all around, he ties a plastic bag around her head and leaves her on the roof of the building where she exsanguinates. Was that depraved? Oh no, said your state Supreme Court, that was not depraved. Well, what do I do with that, right? I mean, if what they're trying to get at is people who behave this way are the worst of the worst, then what do we do with those people? If they're responsible, we throw the book at them. If they're not responsible, we have the sorts of civil mechanisms we now have, but they're all imperfect.
Let's see, that's Michael Wellner's work.
Michael Wellner's work, yes. Mm-hmm.
In the back.
Hi. Hello? Okay. A couple of things I'd love to hear all of you guys or any of you guys speak to is one, the, I guess, correlation versus causation dynamic. I guess I'm reading a lot about eugenics, the history of eugenics, and the, I guess, logic and background of those scientists at that time had a lot of statements where I think you brought up psychopathy as an indicator of recidivism and a measure of that. And when you take that variable away, it's harder to understand or trace the likelihood of recidivism. So if you can speak a little bit to, okay, is one causing the other, or how do you, I guess, distinguish whether or not it's just, high correlation versus causation, if that
makes sense?
Sense?
Just to jump in, so I would say that psychopathy is causing recidivism and not the other way around. I don't think recidivism would cause psychopathy. I think a lot of what I've talked about is entirely correlational. The brain imaging work is correlational. What's more causal are the randomized controlled trials.
Okay. Yeah, so I was asking about psychopathy causing recidivism, but
right.
Yeah.
Yeah, I understand.
That's my answer. I don't know about other
Listen,
people.
when you're using big data to try to make a prediction, and this is one of the reasons I think prediction is going to be the first place that neuroscience is going to be able to be helpful. You don't really have to understand the underlying mechanism. You've just discovered empirically this is a risk factor. We may not know why it's a risk factor, but it is a risk factor. We may not understand how it's working to increase risk, but we know that it does. And so I think Adrian's right about the causal arrow in this case, but it kind of doesn't matter.
Well, I mean, I think one way that it always matters is because a correlation is specific to our place and time and the time and place where the study was done, right? Whereas if we have a causal relation, then we can make claims about how people with that condition will always act.
Okay, fair enough.
And then the other question I had was around responsibility. So there's a lot of discussion about the responsibility of said criminal, depending on whether they are assessed as psychopathic or not. Is there a sense or any discussion around the responsibility of the, I guess, community or environment, and where does that kind of responsibility, how does that responsibility come into play, especially within this kind of legal framework? And then the last little thing that I have scribbled down here is, okay, so if somebody has a mental disorder, then we're talking about restoration of a person, or it has been discussed, this restorative kind of justice thing. But the criminal justice system is primarily about restoration, right, and rehabilitation, and only partially punishment. It's primarily punishment. I see. I've misunderstood the law my whole life. Okay. Thanks.
I'll take a crack at your second point. Until the middle 1970s, the rehabilitative ideal was actually quite strong. It coexisted with retribution, it coexisted with incapacitation, but the rehabilitative ideal was very strong. It became quite clear, and this was very bipartisan in the late 1960s and early 70s, that sentencing practices based on and parole practices based on the rehabilitative ideal were very discriminatory. They were not working. We didn't know what we were doing. And so there was a complete rehabilitation in the middle 70s of the retributive ideal as setting a proportionate cap on what we can do to people. All right, that's a bit of the history. The question you've asked is, do people talk about, is the community in part responsible when people offend the law? There is an extremely lively debate about that now in both the philosophy of law and in the philosophy of responsibility. To what extent should certain kinds of social conditions be in part a mitigating or an excusing condition? One example of that is, should severe environmental deprivation, what used to be called in the bad old days, and I have always thought this was an offensive term, rotten social background, should severe environmental deprivation be in part an excusing condition, and perhaps in whole an excusing condition? There's an extraordinarily lively debate about that today. Some people think yes, and some people think no.
I'll try and chip in a little bit on the, or should we go to other questions?
So we are over time, but I did get a mandate from above that we could take a couple more questions. If people want to leave, we shall not be offended. But maybe, do you want to say something quick, Adrian, and then we can move on to other questions? Or? What questions? Okay, why don't you go ahead? Yeah.
Feminist question here. When you speak about these...
talk directly into the...
I'm sorry, I say feminist question here. When you speak about the fMRIs that are looking at the amygdala, from what I know, much of the research has to do with men. And I'd like you to address this. I know there are females who are psychopaths. But is there some particular research that indicates that the amygdala is different in a man, or any of that sort of subtle distinction?
Yeah, I'm trying to get my mind around the data there. I mean, there are gender differences in the brain. An area connected to the amygdala where there are male-female differences is the underneath or ventral part of the prefrontal cortex. Relative to the rest of the brain, that's smaller in men. And a reduction in that brain area is correlated or associated with antisocial, criminal, and psychopathic behavior, not just in men, but also women. If women have that male characteristic like a reduction in the volume of the orbitofrontal cortex, those women are also more likely to be criminal. If you take the gender difference in crime and you correct for the brain difference that exists between men and women, you reduce in half the gender difference in criminal and antisocial behavior. That's not to say that all of the gender difference can be chalked up to brain differences. Of course not. There's a baby in the audience somewhere, there's differential socialization. You know, we give little girls dolls and little boys toy guns, don't we? Yeah.
Which also can change their brains as well.
Absolutely.
Of course, everything changes your brain.
Everyone's brain has been changed by today. Mine certainly has.
True.
Sitting next to Stephen.
Okay.
I would like to follow up on that question or that comment on environment and community. Mike Tyson has said, everybody has a plan until they're punched in the face. I have no facts and I have no background in it, but my guess is there's some neighborhoods that if a guy leaves the bathroom and some other guy's hitting on his girlfriend, that if he doesn't throw his drink in the guy's face or push him or punch him or hit him over the head with a bottle, his friends and the community will consider him a weakling. So my two-part question. The first part, does environment or the community or culture, can that make a person a psychopath? But my second part is this. Can the government because if that's true, there's leadership in every neighborhood and every community. Can the government put pressure on the leadership in that neighborhood and tell the leadership, keep your crazies under control, or we'll come after you?
I would just take the first bit. Culture is critical, of course. I had a lifer come to my undergraduate class 2 weeks ago. He spent 30 years in prison, a bit more. And, he was in a family where every single person was a criminal. Both parents were criminal and the 9 siblings were criminal. No, 11 in total. 11 in total. Can't do my addition. Yeah, I mean, he was socialized right from the very beginning into a criminal way of life. They had no food. They were fighting over every scrap of food that they could get. Whether it's genetic or environmental, I would say in that case, toxic mix. So for sure, culture is critical, and culture and the environment does affect the brain, affects behavior. But the second part is a bit tricky. I'll leave it to somebody else.
Do you want to take a crack or shot?
Go ahead.
No, go ahead.
Well, I think that there's certainly hugely strong evidence that environment feeds into antisocial behavior. But I think the connection between environment and psychopathy in particular is a little bit trickier, isn't it? I mean, there's some evidence about severe childhood sexual abuse as being an environmental factor that can lead to psychopathy, and I'm sure other people are probably better experts on this than me. But it doesn't. I don't think there's a lot of evidence that just kind of very harsh environmental conditions leads strongly to psychopathy.
I think where you could salvage it, though, is to say these harsh conditions are certainly associated with criminal behavior, and that's a chunk of psychopathy.
Okay.
Second question you asked was, can the government, by pushing around the leaders in the community, do anything about it? The short answer to that legally is no. That's a complicated discussion, but the short answer is no.
Okay, we have one.
There are certainly protective effects. I mean, we haven't talked about policy that can actually implicate, can lower levels of criminal activity. And there's very clear educational structures and other sorts of programs that actually decrease antisocial activity. Can we make our local leaders implement these sorts of programs? Well, I guess we can vote, right?
Okay, final question.
What is the difference between psychopathic and sociopathic?
Well, I would say that basically, people may disagree. I would say that basically both the same terms. Sociopathy is an older term. Well, actually, originally it was psychopathy in the 19th century. But then in the 40s, 50s, there was a sense that it's the social environment that's creating these crazy people, that it's sociopathy. And in the research literature, 2/3 of the time people are now using the term psychopathy. Ariel, would you have any addition to make on that?
Basically, it's used to distinguish what the root sociopathy, the cause is typically related to environmental conditions early on. Not to say those environmental conditions can't then change the brain, but the starting cause is environment for a sociopath.
You're saying that's how the terms are used now, still? Yeah. Okay.
Versus biology.
Yeah. All right. Thank you all so much. We're going to have a reception and continue the conversation.